I've been a social worker for 33 years, mostly in the Houston area, working with catastrophic injuries, primarily neuro rehab. So that staying in the here and now, kind of looking at the glass half full versus half empty. All of that comes from CBT, cognitive behavior therapy, or dialectic behavior therapy, DBT, and sometimes this other strategy called ACT. But all of them have to do with managing your feelings and actions through your thoughts. So in CBT, there's this triangle, you know, and at the top is your thinking. And on one side is emotions and the other side is action. So if you think about people get angry, especially when they're younger, you get angry, you punch, you go right to the action. And what in looking at coping strategies, one of those is, I have this feeling, I have this very distressful feeling. It can be depression, anxiety, anger, irritability, frustration, fear, guilt, any of those things that are seen as distressful feelings. So being able to kind of stop and say, I am feeling, you know, label, I am feeling angry. Okay, I want to punch her, but what should I really do? I can't punch her, that's going to be bad. But what can I do? So you're moving to the top of the triangle. You're going to think. So you're going to go from emotions to thinking to action. So it's always going to look like this. And then the action goes back to the feeling of some calm, of some level of calm, or I've got this in some way. And so using that, I think that's just like a basic kind of thinking about coping skills, is being able to utilize, go from dark thinking to clear thinking. So how can we shift this? I can't drive anymore. I can't go to work anymore. I'm overwhelmed as a caregiver. Okay, those are all dark thinking. What can you do clear? You know what? I am doing better at caregiving than I did 2 weeks ago. So I'm making progress. This is going to be a process. It does kind of suck. It does suck a lot, but I have made progress. It is taking less time to get my father out of bed than it did a month ago, because I've learned a better way of managing the Hoyer lift. And it may not, or he has made more improvement. He's helping more. We're communicating. My dad and I laughed the other day. We haven't laughed in months. So looking at what are those things that you can have gratitude towards? What did you learn? What are you going to accept? I don't have control over changing the accident my loved one had. I can't keep doing the what ifs or those guilt. I need to accept that this is where we are. And then how do we continue on? As far as coping, those are two, and giving yourself a break. Give yourself, and that's what a group can do, a support group. Those people that understand what you're doing, being able to validate that it's okay to be frustrated, to validate that this is normal to feel sadness, this is normal to be exhausted, because, you know, oftentimes caregivers are like, oh, I can't complain, why am I, you know, and so the support group can do those things. They can be able to also, you know, you can vent your frustration, you can, you know, so one of the ways to develop those coping skills is come to a caregiver support group, be part of one, and know that you don't have all the answers, and you're not perfect. You weren't perfect before. Guess what? You're still not perfect. You know, this life event, this trauma, did make you better at being able to manage things. Last one, I'm sorry. I feel is that healthy versus unhealthy? You know, when you're trying to cope, those things, those foundations of sleep, nutrition, breathing, taking care of yourself, both physically and mentally, and not like, what if I'm stressed out? I know when I'm stressed out, sometimes I need to get up and move. So that's good. That's a good one. That goes in the pro. But I also find I eat more sugar. That may not be, you know, overeating, alcohol, drugs, being more abusive. You want to be able to make sure you pause and not have those coping outlets that are unhealthy, and being able to put yourself in check and go to the healthy ones.